Big news in diabetes. For over 100 years, we've treated type 1 diabetes after it develops, but now, in the first time in the NHS, has approved the first drug that can actually delay the condition before the symptoms appear. It's called teplizumab, and basically works with targeting the immune system. So basically, the immune system is the main culprit in type 1 diabetes. Main thing to realize is it's not that it's a cure or it doesn't prevent type 1 diabetes. However, it delays the actual onset by a few years, which is a good start. As a GP, I was actually looking into how are we going to get the actual screening done for patients, because most of the patients we pick up are kids who already have developed type 1 diabetes. So they will come with peeing a lot or drinking a lot, being very tired, losing weight, and then we actually test their blood sugars and ketones and things like that, and we find out they already have developed type 1 diabetes. So right now, most of the GPs diagnose stage 3 type 1 diabetes, like I've explained before. However, this is more specific for patients who have not had any clinical symptoms. So it would be essentially screening patients who are first degree relatives or patients who have type 1 diabetes, like siblings. Perhaps we can do blood screening. So we tend to do these antibodies testing. I think it's more specific to endocrinologists, but things like GAD, insulin antibodies and things like that. So I guess the next step would be actually perhaps getting some education for GPs and clinical staff in understanding patients who can be picked up in the normal population, whose, let's say, mum brings in and say, oh, his sister had type 1 diabetes. Then perhaps we can screen them by doing things like I mentioned, and then the medication would help delay if they are found to have positive antibodies. Do any of your children or anyone you know have type 1 diabetes in your first relatives? Comment.